My name is Dr. Aisha Harris, and I'm a family medicine doctor and curator of Black Fam Doc, an outreach platform. My immune system is now more powerful against the coronavirus now that I received the second COVID vaccine, specifically the Moderna vaccine. I've received many vaccines in the past, including the yearly flu vaccine as well as the original HPV vaccine. And I know people are worried about what the future looks like. I'm worried too. I know people are tired of the constant cycling of the COVID information, the precautions and recommendations. Our digital world has made access to information easy, but it's also very overwhelming, and I get it. I'm tired too, but I believe in science and the process of evidence-based medicine improving quality of life. I'm a Black woman first, and a family medicine doctor later. I have family and friends with chronic diseases that will not respond well if they potentially become symptomatic with COVID. I have patients who had the coronavirus and are now having trouble bouncing back, wondering what the long-term impact will be on their health and their life. Many people think they won't get infected, but the reality is 50% of people are asymptomatic. That means 50% of the people with the virus are spreading it and don't even know it. These masks are helpful and necessary and important even after the vaccine until we have a good handle on this virus. Many people have questions about the vaccine and how it was developed, and that's right, and they're rightfully hesitant. I get it. I was hesitant too last year until I sat down and looked at the reports. And I know a lot of people don't want to sit down, go through all the data, and commit themselves to that time and that information. But I encourage everyone to look at data from good resources who have evidence-based recommendations and conclusions. And also look at the history of vaccines and their success. Vaccines are really amazing innovations that have saved hundreds of thousands of lives in the last 100 years. Now, the Black community has reservations around the vaccine, like many people in America. But there are multiple barriers we have to address that include the current hesitations as well as the distribution nightmares we're experiencing. We know there's a history of medical abuse that has contributed to the hesitation in the Black community, which is not forgotten and is still trying to be addressed. The system has not always been kind to us, but please look at all the reasons, risks, and benefits of getting the vaccine and resolving the pandemic. Though distribution is improving, only 5.4% of vaccines so far have gone to Black people. This is way too little considering the increased complications, hospitalizations, and deaths that the Black community has experienced due to COVID. My fear is that we'll get left behind, and the health disparities before and during the pandemic will be worsened. 30% of hospitalizations due to COVID require intensive care, and unfortunately 1 in 10 hospitalizations due to COVID end in death. These numbers are even higher for the Black community. I got the COVID vaccine because I believe in science despite the bias that exists in this country. I live and work in a world that tries to belittle the beauty and power of Black people in the Black community. Despite my personal frustrations with being Black in America, I think the COVID vaccines are safe and important to get us out of this dark chapter. We have been in this pandemic for a year and counting. The grief in this country over the hundreds of thousands of deaths make the reality of lost life way too common. The equitable distribution of the COVID vaccine is important, and it's still a work in progress, and it's still a little messy, but give it time, it's going to get better. I encourage everyone to be part of the change in direction and to not let the opportunity to live your best life pass you by. I got the COVID vaccine. I trust the vaccine, and I'm ready for this pandemic to be over.